Let's talk about sex, baby. Let's talk about you and me. Let's talk about all the good things. Let's talk about sex. Hello guys, I am Dr. Raisha and this is the fertility series with Dr. Raisha. In this video, we are going to talk about the 5 sex tips to get pregnant naturally and the myths about getting pregnant. Let us start with what is the best time to have sex when trying to get pregnant. After intercourse, the sperm stay in a woman's body for 5 days. It doesn't have to stay in your body for 5 days. It can be 3 days, 2 days, but they can stay for up to 5 days. But when an egg is released, it can stay in a woman's body for just 24 hours. It's a diva. It's just making an appearance. I'm here for a good time, not a long time, baby. So, if you want to make a baby, timing is everything. I want you to look at it this way. If you have sex 5 days before ovulation, there is a high chance the sperms will still be hanging around by the time the egg is released, hence leading to fertilization. But there are higher chances of getting pregnant if you have sex on the day of ovulation or the day before ovulation. But that is not the issue. The issue is, how do I know my ovulation days? We have many signs that you can watch out for to know that you are ovulating. These are such as changes in the cervical mucus, a rise in the basal body temperature, increased libido, and breast tenderness and soreness. I have made a video explaining all these signs in detail. Just check it out. You can also calculate your ovulation day using your menstrual cycle. Your menstrual cycle is the first day you get your periods to the last day before your next period. It is normal if your cycle lies anywhere between 21 days to 35 days. Now, to calculate your ovulation day, you just need to say your menstrual cycle length minus 14. So, if your cycle length is 35 days, you say minus 14. So, your ovulation is on day 21. If your cycle length is 28 days, you just need to say minus 14. So your ovulation is on day 14. Now let us assume that you have a cycle of 28 days. Does that mean that you will always ovulate on day 14? No. Not necessarily. We give it an allowance of plus or minus 2. So 14 plus or minus 2, that is 12 and 16, meaning you can ovulate anywhere from day 12 after the first day of your period to day 16. Now, let's calculate your fertile window. The sperm can stay in a woman's body for up to 5 days, remember? So, you need to say the first day you can possibly ovulate minus 5 days. So in this case, the first day you can possibly ovulate is day 12. So 12 minus 5 to give you 7. So you have to say day 7 all the way to day 16. That is your fertile window. And there are high chances of getting pregnant if you have sex during this time. But your cycle can vary monthly, making it a bit hard to predict. But there is another way, and now this is the best ovulation predictor kits. You just need to pee on the kit, and if it shows 2 lines, that means we are ovulating and it's time to make some babies. We have some kits such as the Raisha LH ovulation test kit, the Aerovita midstream ovulation test kit, and AccuFast LH midstream test kit. In Kenya, you can just check out my Dawa. I know they have some of these. How many times do you need to have sex to get pregnant? Trying to get pregnant can be really stressful, and most couples keep wondering, will it ever happen? Setting intercourse at a specific time can become stressful and reduce the satisfaction that comes with it. So the best advice I could give you as you try to conceive, try as much as possible to enjoy the process. Make it fun and exciting. You can choose to have sex daily. That is great. If you can manage every 2 days, 3 days, or every other day, that is fine. But studies show that regular sex increases the likelihood of hitting the fertile window. A study in the journal Human Reproduction found that having sex every day increases the probability of conception compared to less frequent intercourse. Some studies, however, say that frequent ejaculation may reduce the sperm count and sperm quality, but several studies have been done and discredited this. So, if you can have sex daily, go for it. No judgment. Actually, I think it's very cool. What is the best sex position when trying to get pregnant? Now, this is a good one. Most people say that if you want to get pregnant, you have to choose a position that will offer deep penetration, depositing the sperms near the cervix. Now, these are classic missionary, doggy style, reverse cowgirl. Don't forget, there's another one called wheelbarrow. The uterus may naturally lie in different positions. It could be anteverted, retroverted, or normal. A normal uterus looks like this, something like this. So this is the uterus. Then of this small opening here is the cervix. So when it is, now this is normal. When it is anteverted, it tilts forward towards the bladder. When it is retroverted, it tilts backwards towards the spine. Now, I have heard some gynecologists who advise that based on the position of your uterus, some sex positions are best preferred. Sperms don't have a map of the cervix and the uterus, and sometimes they need all the help they can get. So first, you need a scan to know the position of your uterus. And if your uterus is retroverted, the best sex position is doggy style. But it is a bit uncomfortable for some people, and this is because it hits directly on the cervix. Hence, when sperms are deposited there, they can easily swim to the uterus. But when the uterus is anteverted, the best sex position is missionary, preferably with the lady on top. I just had to get this out there because I believe there is no harm in trying any of these styles. After all, it is all about enjoying the process, right? But believe it or not, there is no scientific evidence proving all this. Experts still lack conclusive evidence when it comes to answering these questions. And I wonder, if they decided to do a study, how would it be done? Like, we had 100 research participants, all of whom were couples trying to conceive. In our cohort study, 10 couples tried the classic missionary position, while 40 couples opted for the reverse cowgirl. But but all we need is to get the sperms into the vagina. And I believe you know how fast those things can swim. So it's not so much about the position. Just do it. Do you need to orgasm to get pregnant? Wow. The answer is no. For conception to occur, we just need to hook up two people, and that is the egg and the sperm. When they meet, fertilization occurs, and bam, we have a baby. It does not matter if you have an orgasm or not, but don't get me wrong, you should have orgasms. Can I use a lube if trying to get pregnant? Yes, you can use a lubricant when trying to get pregnant, but it is important to choose the right kind. Some lubricants can actually hinder the sperm movement and reduce your chances of conception. Some people use saliva as a lubricant. Now, that is not a very good lubricant because it reduces the sperm motility and also it quickly evaporates, leaving you with no lubrication. We have some fertility friendly lubes that are meant to mimic the natural cervical mucus, and they do not affect the sperm motility. But hold on, I'm not saying that you should just walk into a pharmacy or a supermarket and pick any lubricant labeled fertility friendly. No, you need to look at the content of this lubricant. If it contains parabens, drop that. We don't want that because parabens generate reactive oxygen species that damages the sperm, reducing their concentration, motility, and quality. So we want to look for lubricants that contain hydroxyethyl cellulose or that are hydroxyethyl cellulose based. I have seen some people vouch for some lubricants like Precede and Conceive Plus. I'm not advocating for those specific brands, but they are options. But it is good to note that lubricant does not improve fertility, but rather it makes the process more enjoyable. Trying to conceive can be a little stressful for couples, and if you are having trouble conceiving, I advise you to visit your gynecologist first. A lot of things can lead to infertility, such as blocked tubes, endometriosis, PCOS, fibroids, PID, just to name a few. So it is great to have investigations done first to identify what is causing the problem, because these tips cannot make you fertile. They just improve your chances of getting pregnant. Now, what are the myths about getting pregnant? Now, as usual, we have a lot of myths going around out there, and it is our duty to debunk all of them. The first one is avoid immediate urination after sex. That is a lie. Sperms swim very fast, and the urethra is not inside the vagina, that the urine will just flush out the sperms as you urinate. No, actually, urinating after sex prevents UTIs. Another myth is that after intercourse, lying on your back with your hips elevated and legs in the air for about 15 to 20 minutes can help gravity assist the sperms to move towards the cervix. You don't need to do that. You don't need that. But somebody will ask me, when I stand up, the sperm start trickling down my vagina. That is a good question. But when a man ejaculates, that fluid is called semen, and it carries millions of sperms. So when the sperms are deposited into the vagina, they start swimming towards the cervix with one goal: to meet the egg and fertilize it. But not all sperms manage to get to the egg. Some are weak, some die. Yes, this is true. Sperms are single cells that do not have the ability to think or navigate consciously. They rely on chemical cues and their own motility to move. So if a sperm encounters a barrier, it does not have the capability to think about finding an alternative route. Instead, it will either continue moving randomly or follow the chemical gradient of signals such as the chemoattractants that are released by the egg. So this lack of conscious navigation means that many sperms do not reach the egg. But that is okay, because what we need is just one sperm. So what is trickling down are the weak sperms, the dead sperms, and of course the seminal fluid. Diet is also very, very crucial when it comes to conceiving naturally. We know that high sugar, high cholesterol diets can create a lot of inflammation, and this can affect ovulation in women and oxidize sperms in men, reducing the sperm quality. So if you are wondering what the best fertility foods are, then watch this video.